The purpose of research in genetic testing is to link any findings in genetic variants in your DNA with findings in your body. So in this case, in your eyes. It can also be relevant to your neurological system or your heart and multiple other areas in the body. And we have to take into consideration what information this is going to provide back to us and how we're going to distribute that information back to you. It's all done in a confidential manner because this is sensitive information that is going to be relevant should new treatments become available. We link this in also with your family history, and that's important for a few reasons. The main one being that we want to find out an idea of the inheritance pattern of this gene. So are other family members going to be affected, and try to predict which branch of the family or who is likely to inherit this gene. And then that can guide further investigations and map out the rest of the family. Even when there isn't treatment available, this is relevant so that future parents can provide family planning. And in some cases there will be new treatments, but it's also important to use that information to develop knowledge in this area and to see what the links are internationally. The confidentiality of your information is absolute. So when we get a result back from the genetics lab, we then link that in with your information that we get today, and that's what we call phenotyping. So it involves a number of clinical tests from speaking to you as well as examining your eyes and a few additional tests like images. And then we can decide the relevance of that genetic result and is it accurate in your case. And sometimes there is a treatment, but other times it may be further back in development, or it may be at a stage where there is very little progress made in that area already, and that's something that we may be able to develop locally. As we go along, we can take breaks for any questions that you would like to ask, and that often gives us more information that we wouldn't have otherwise known if you hadn't brought up the specific topic. But we like to think that this is a continuous process as well, so although today is quite a long visit, we keep regular contact with you so that we can always update that information and ensure the accuracy of the result that we can provide back for you.